Epidemiology is the study of how diseases and health conditions are distributed in populations, and what factors influence these patterns. It's like being a disease detective. Population health nursing uses these findings to protect and improve the health of entire communities. Nurses use epidemiology to understand why some groups are more likely to experience certain health problems and to develop effective interventions. For example, epidemiology might help us understand why certain neighborhoods have higher rates of asthma. Is it due to air pollution or a lack of access to healthy food? By understanding these patterns, nurses can advocate for policies and programs to address these issues and improve the health of the entire community. Epidemiology and population health nursing go hand in hand. Epidemiology helps us answer these critical questions. What are the health problems in our community? Who is affected by these problems? What are the causes of these problems? What can we do to prevent these problems and improve the health of our community? By using epidemiological principles, nurses can make a real difference in the lives of individuals and communities. They can identify health disparities, implement effective prevention programs, and advocate for policies that promote health equity. Epidemiology empowers nurses to be true champions for health. Epidemiology relies on several key concepts to understand disease patterns in populations. Let's break down a few of the most important ones. First, we have incidence. This refers to the number of new cases of a disease that occur in a population over a specific period. Think of it as the rate at which new cases are appearing. Next, we have prevalence, which tells us the total number of people in a population who have a particular disease at a given time. This includes both new and existing cases. Prevalence gives us a snapshot of how widespread a disease is within a population. Finally, the mortality rate tells us the number of deaths from a specific cause in a population over a specific time period. This measure helps us understand the severity of a disease and its impact on a population. These three measures, incidence, prevalence, and mortality rate, are fundamental to understanding the burden of disease in a population. They provide valuable information for planning public health interventions, allocating resources, and monitoring the effectiveness of health programs. In epidemiology, risk refers to the probability that an event like a disease will occur. Risk factors can increase or decrease this likelihood. For example, smoking is a risk factor for lung cancer. Smokers are more likely to develop lung cancer. Understanding risk factors helps in prevention, but correlation doesn't always mean causation. Confounding variables can affect outcomes. They make it seem like one factor causes another. For instance, coffee drinkers might also smoke. Smoking, not coffee, could cause heart disease. Epidemiologists control for confounding variables. This ensures accurate and reliable findings. Section 4. Study designs in epidemiological research. Epidemiologists use various study designs to investigate disease patterns and risk factors. Common designs include cohort studies, case control studies, and randomized controlled trials. Cohort studies follow groups over time to compare disease risk. Case control studies compare past exposures between cases and controls. RCTs randomly assign interventions to determine cause and effect. Cross-sectional studies assess disease prevalence at a single point in time. Understanding these designs is crucial for evaluating research findings. Section 5. Levels of prevention: primary, secondary, and tertiary. Prevention is a cornerstone of public health, and epidemiology plays a critical role in developing and evaluating prevention strategies. We often talk about three levels of prevention: primary, secondary, and tertiary. Primary prevention aims to prevent disease or injury before it ever occurs. This includes interventions like vaccinations, promoting healthy lifestyles such as a balanced diet and regular exercise, and ensuring safe environments like clean water and air. Secondary prevention focuses on early detection and treatment of disease to prevent it from progressing to a more serious stage. This includes screenings, such as mammograms for breast cancer detection and regular blood pressure checks for hypertension. Finally, tertiary prevention involves managing and minimizing the impact of existing disease or disability to improve quality of life and prevent complications. Examples include rehabilitation programs for stroke survivors, chronic disease management programs for conditions like diabetes, and support groups for people with chronic illnesses. Each level of prevention plays a crucial role in improving population health. Epidemiology helps us understand which interventions are most effective at each level and identify the populations that would benefit most from these interventions. Section 6. Modifiable and non-modifiable risk factors in public health. As we've discussed, risk factors are characteristics or behaviors that increase a person's chance of developing a disease or health condition. Some risk factors can be changed, while others cannot. Modifiable risk factors are those that individuals have some control over. These include lifestyle factors like smoking, diet, physical activity level, and alcohol consumption. By making healthy choices, individuals can reduce their risk of developing chronic diseases like heart disease, stroke, type 2 diabetes, and some types of cancer. On the other hand, non-modifiable risk factors are those that individuals cannot change. These include factors like age, sex at birth, family history of disease, and ethnicity. While individuals cannot control these factors, it's important to be aware of them so they can take steps to mitigate their risk through other means, such as regular screenings and early detection. Understanding the difference between modifiable and non-modifiable risk factors is essential for developing effective public health interventions. While we can't change someone's genetic makeup, we can promote healthy lifestyles and create supportive environments that empower individuals to make choices that reduce their risk of disease. Section 7. The role of nurses in utilizing epidemiological principles. Nurses are on the front lines of healthcare, and they play a vital role in applying epidemiological principles to improve the health of individuals and communities. By understanding disease patterns, risk factors, and prevention strategies, nurses can make a real difference in people's lives. Nurses use epidemiological data to identify health needs and priorities within their communities, develop and implement targeted interventions and health education programs, evaluate the effectiveness of these programs and make adjustments as needed, and advocate for policies and resources that promote health equity and address health disparities. For example, a nurse working in a community with a high prevalence of diabetes might use epidemiological data to develop a culturally appropriate diabetes prevention program. The program might include nutrition education, cooking classes, and group exercise sessions tailored to the community's needs and preferences. By using their epidemiological knowledge, nurses can empower individuals to make informed decisions about their health, connect them with resources, and work collaboratively to create healthier communities. Epidemiology is an invaluable tool in the nurse's toolkit for promoting health and well-being.